Started. So I know there's a few folks still joining, but let me go ahead and do the intros first. Welcome, everyone. My name is Jennifer Alvisuras. I am the HIT Program Manager at Healthcare Authority. I'm joined today by Angela Tesluk, and we will be talking today about the Washington Electronic Consent Management System. We're excited to have you here and share the progress and updates from the ECM. And so whether you're new to ECM or you want to connect to ECM or just ask questions, or learning about ECM for the first time, we are glad that you're here with us today. Next slide, please. So today we're going to dive into why the electronic consent management solution was built. I will talk about how it could be used, provide updates since our last webinar, and we'll show a demonstration. And finally, we'll be able to answer some of the questions from the chat. So please feel free to put those questions that you have in the chat, and we'll make the most of the QA session at the end. So let's get started. Next slide, please. Okay. So the Washington Electronic Consent Management System is called ConsentLink, and you'll hear me refer to it as that throughout the presentation. And first, I'm going to take a few moments to talk about some of the background of how ConsentLink fits within this larger IT ecosystem here at Healthcare Authority. HCA's strategic goals aim to modernize our health technology infrastructure to connect over 2.9 million Washingtonians to over 75 health and human services, with the goal of making healthcare access more equitable and patient-centered. So our technology means creating a user experience that reduces the barriers people have to access those services. Our initiatives are developed as modularized components to allow for a strategic transformation of our technology and ensure consistency, quality, and efficiency for providers who are using this tool. And some of the other major initiatives that can be interoperable with the ECM include the 988 Suicide and Crisis Lifeline, the statewide electronic health record system, community information exchange, the master person index, integrated eligibility and enrollment systems, and those are just to name a few. There's more out there. Next slide, please. So this solution was built to find a better way to share data. From the feedback we've gathered from providers, we've learned that when a consent to share information is needed, there are high administrative burdens to get that consent signed and then delivered to the appropriate recipients. We've also learned that there are multiple barriers and inconsistent processes full of bottlenecks and silos, which result in having delayed care and overall frustrating experience. So this lack of uniformity in process and this lack of available technical solutions has inhibited the connection of health systems in Washington and created barriers for both patients and providers. And so this electronic consent management solution seeks to eliminate those barriers and support providers who exchange consent forms to send and receive sensitive data. Next slide. So I'm going to jump into how the ECM was developed. Okay. From provider focus groups, again, we've learned about the barriers to sharing consent forms and about individual providers' needs at different organizations. So HCA set out again to create a consent management solution that facilitates that patient authorized exchange for sensitive data. This system is meant to house consent forms to be securely accessed by providers who need the forms quickly. And with the system, a consent form is uploaded or created and housed in the solution and is reliably accessed by the provider who needs it and receives it. As I mentioned earlier, our consent system is called ConsentLink, and ConsentLink is now live to be used by Washington state providers. ConsentLink supports organizations with varying levels of technology adoptions. Our goal here is to meet providers where they're at in terms of their technology capabilities and their infrastructures. The use of ConsentLink is not mandated by HCA or the states, and we will this will be a resource for providers and Apple Health beneficiaries to handle consents more efficiently. There is no cost for providers to manage consents for their clients using the system. Next slide. We have come a long way since we started this endeavor. This ECM project began in 2020 with provider focus groups, which were intended to gain an in-depth understanding from the cohort participants as to their process for exchanging release of information forms, including those that are specific to 42 CFR Part 2 and otherwise. And then in 2021, we started the request for information phase. During this phase, we met with other states planning to do an ECM, and we also continued to discuss provider consent feedback and various approaches to adoption. After several stakeholder and partner requirement gathering sessions, the Healthcare Authority released a request for proposal in the fall of 2022. HCA received 5 proposals, 3 of which moved on to the second phase of their proposed products were demonstrated. And in early 2023, HCA chose a vendor through a successful request for proposals process, and that vendor is CodeSmart, who has subcontracted with Medado Health. In the fall of 2023, vendor kickoff work began, and this is the first phase of this solution, which is called the baseline phase. And ConsentLink went live August 2024. At which point we conducted a 6-month pilot, and this pilot ended in February of 2025. And since mid-February, the system is now live and is open again to all providers. Next slide. And since the initiation of this work, you've already heard me talk a little bit about this, but we've been focused on outreach and engagement. We've gathered feedback through focus groups, public webinars, one-on-one calls, and user acceptance testing with providers. And these engagements are vital for us because they help us learn about the interplays between the various workflows within an organization so that we understand how ConsentLink can enhance health outcomes for an organization. Our holistic approach is centered around understanding unique needs and providing comprehensive support throughout the technology's adoption at an agency or an organization. We also emphasize the importance of addressing barriers such as accessibility and digital literacy to ensure equitable access to those who use it. Some of the materials that we've created include the ConsentLink training guides and our videos, and the Substance Use Disorder Information Guide to help clarify the applicable federal regulations and laws. We've also created an HCA consent form, which is compliant with updated federal and state policies. Next slide, please. So with the launch of ConsentLink, HCA has become the first Medicaid agency in the nation to launch an ECM solution. The HCA team and our vendors are very engaged with consent management conversations nationwide and continue to keep up to date with the newest information out there. We completed a 6-month pilot on February 14th, 2025. The lessons learned and the feedback from this pilot will be used to continue to improve new features for future updates to ConsentLink. And again, I want to emphasize this. We are now onboarding all interested providers. We have a very thorough onboarding process, and we will provide multiple sessions to support organizations be completely ready to use the system. And sessions include configuration sessions of consent forms, training sessions, and testing sessions. Next slide. Okay. So now let's jump into what exactly ConsentLink is and what we can help with. Okay, some of the system features, some of you have heard me talk about this before, but include optical character recognition or OCR, since a lot of providers and practices still are heavily paper-based. Optical character recognition is capable of scanning and creating digital consents. And we have found that consent forms across the state are very widely from electronic to very paper-based, and the way that they are configured also or formatted also very widely. So we will meet providers where they're at and allow them to um, and allow us to create this very specific consent form in ConsentLink. And it will be configured in our system and could be used to upload paper forms. And the uploaded versions of these forms are not just an image, but they are in fact, um, the system can extract metadata out of it once it's uploaded. Another feature is this consent expiration reporting, and this is one of the several analytic reports offered. Many provider organizations expressed that it would be great to see a report of all of the consents that are expiring within a certain time frame within their organization. And this will allow providers to get ahead of the workflow and ensure that active consents remain on file for every patient when they are seen. A consent link offers a suite of other various customizable reports that can supply analytics for an organization. Another exciting system feature is um, the secure cross-organizational access, excuse me. This is a built-in system logic determined by customizable role-based permissions for different staff members. Again, we're really heavily focused on privacy and security, and so we want organizations to have some flexibility about which staff members can have access to which part of the system. So this piece is customizable. And lastly, ConsentLink offers multiple languages. Currently, the system can accommodate consents in Spanish and English, with plans to expand into several other languages in the future. Next slide, please. Okay. So this diagram shows our current state of ConsentLink. Currently, the system does not include client self-management. Given the scale and the uniqueness of the system, we want to ensure the smooth operations within provider organizations before giving clients access. But you'll notice two primary paths of use. So it's either a standalone or interface with an EHR. And currently, ConsentLink uses this top path that you see. A provider accesses ConsentLink via a web portal outside of their EHR. And here they'll be able to create, modify, upload, or revoke consents in ConsentLink. The second pathway, this bottom pathway in this diagram, is the interoperability pathway with an existing system or an EHR, and would be using the FHIR standards. This pathway is not yet available, but it is a priority for our future versions of ConsentLink. ConsentLink, again, is free to use, and HCA will support organizations with the onboarding process. Next slide. So let's move on to the details of what makes this solution essential technology. I mentioned earlier, we are purposefully implementing approaches to understand workflows and challenges individual providers or organizations face. Um, so um, we've set up a portal, a web-based portal to help these providers and meet providers where they're at based on their technology levels. Second, given the nature of the work that we do, privacy, security, and compliance are our top priorities. ConsentLink has undergone an Office of Cybersecurity Security Design Review and received SOC 2 Type 1 certification before we went live and SOC 2 Type 2 after going live. And these are all cybersecurity compliance standards. Lastly, there is an essential technology. This is essential technology because it offers observability tools to keep operations running smoothly and to allow organizations monitoring and adherence to regulatory and compliance practices. Really, this is great for compliance reviews and making sure um, your organization has reports on what's going on with the system. Next slide, please. Okay. To recap, ConsentLink is about modernizing the way consent forms are processed in order to share data faster. So, for example, this would eliminate disjointed processes since forms would be online. This would allow quicker access to a consent by removing faxing consents to unknown recipients. And this system simplifies workflows as well as provides users with the confidence that the form they're using is compliant with policies and rules because we are configuring forms that are compliant to ConsentLink. Next slide, please. Okay, so we are not building out consent. We are not done building out ConsentLink. There's still a lot to come, and in the next few slides, I'll go over what that might look like in the future. So next slide, please. ConsentLink will be built out in multiple stages, which will allow us to incrementally build on and add more functionality with less risk. And some of the priorities are included on this slide, which include the HL7 Fire Standard implementation to promote interoperability with existing systems. I talked a little bit about the client self-management capabilities that we hope to be a future functionality. Um, we want flexibility and scalability with other HCA initiatives, and some of the major initiatives are included here in this slide, which I mentioned earlier. And we want automated information exchange authorized by patients. And so um, the next slide will show a diagram of what that might look like. Looking at this diagram, you can see that there are new components added to the initial diagram, the initial workflows and pathways. And so some of these are highlighted in green. Um, in expanded phases, we will build out these additional functionalities, which can include um, the client self-management capabilities, which might be like a mobile app. It could also be additional functionalities with interoperability with other HCA IT systems, like to make sure that a consent is on file when patients need it most, or to automate enrollment in with other services offered by the state, for example. Next slide. Okay. Bottom line, we're creating a health information technology to ease administrative burdens. Um, we want these manual exchanges to be automatic and improve health outcomes for patients. And to make it more accessible to organizations, we're offering the system at no cost, and we're offering assistance to implement the use. Um, and we want to make sure that this system supports your organization and your pathways instead of creating new barriers. Next slide. So if you're ready to innovate and use ECM, I will share in the next slide some onboarding criteria. Okay. I mentioned these throughout the presentations, but here they are listed. The onboarding criteria include being a Washington State organization or primarily serving Washington State, serving Apple Health population, having organizational leadership's endorsement, and we can help with this by presenting to your leadership or having conversations with them. The next criteria, excuse me, is to administer the HIPAA or 42C4 Part 2 compliant consent forms to exchange information, i.e., if you use one of these forms, then you would be a great candidate to use ConsentLink. So now, if you're not sure if your organization meets these criteria, feel free to reach out to us, and we will be happy to have that discussion and talk about more in-depth pieces regarding to IT or any of the things we've talked about today. Next slide, please. So here are some more resources. I will put 3 links in the chat. The first one is our ECM listserv. Second is our ECM webpage, and the third is our email. Please reach out to us if there are any questions, big or small, and we'll be happy to follow up. And with that, I will turn this over to Angela.
All right, thank you, Jennifer. So with that, I want to go ahead and jump into doing a system demonstration. But before that, I'll do a quick intro. So thank you all for joining us today. My name is Angela Tesluk, and I'm excited to walk you through how ConsentLink can support your organization in managing patient consents more efficiently. So a high-level overview of today's demonstration. We'll start with a brief background on ConsentLink, what it does and what it does not do. Then depending on time, I would like to go through a few different user roles and scenarios to illustrate how ConsentLink supports consent management in various healthcare settings. So a couple scenarios that I have is a registrar creating a patient consent via direct data entry, a health information technician uploading a consent via scanning, how privacy or compliance manager can manage user permissions, and how a director of health information management can export reports for quality monitoring. So with that, I'd like to move into what the system does do. So ConsentLink is a centralized platform for managing patient consent related to health data exchange. It enables authorized users to create, manage, and review patient consents electronically. So what does ConsentLink not do? ConsentLink currently does not support interoperability with existing health IT systems. As Jennifer mentioned, this is part of the planned expanded solution. So with that, I'm going to go ahead and pause there. I'm going to turn off my camera and move into the demonstration. So give me just a second while I set that up. Okay. Are you able to see my screen? ConsentLink?
Yes, we can see it.
Okay, perfect. So the first scenario that I want to jump into is walking through OCRing a consent form. So we're going to go ahead and log into ConsentLink. And in this scenario, as part of my workflow, I am a health information technician. My name is Angela Test, and I work at Test Seed Organization 001. This information is found on the top right of the screen. And so for my day-to-day, I receive consents into our Dropbox, and I need to upload it into ConsentLink to make sure that other providers who are mentioned on the consents have access to them if they're listed on the consent. So the first thing that I'm going to go ahead and do is find the consumer. In ConsentLink, consumer is the same as client or patient. So my consent here says that Leonardo DiCaprio would like to share his health information. So I'm going to search for Okay. So we have Leonardo DiCaprio's profile pulled up and we want to OCR consent. So we're going to go ahead and select upload consent. My screen here lists the templates that my organization has onboarded. Because I do have admin view, there are quite a couple different options. So I'm going to go ahead and select HCA consent to coordinate care and treatment. And then I'm going to choose my file. And in my scanned consents folder, I have the consent form that Leonardo DiCaprio has shared with us. And I'm going to go ahead and click upload. So OCR is going to take a moment to load. Perfect. So this is the HCA form that we have developed, and we're going to review the form to make sure that OCR has captured all of the information from the consent form itself. So the first part of the form is informational. We're going to go ahead and click next. Same with the second part. And then now we're reviewing who is disclosing this information. Or what type of information I would like to disclose. So we have option 1, medical records, option 2, claims data, and we have both have been selected. So that looks great. We're going to select next. Then we're looking at who is disclosing the data. And since Leonardo DiCaprio was seen here with us at Test Seed Organization 001, it looks like OCR would like us to enter the organization name. So we're going to search for that. And it pops up for us. I'm going to select next, and then we're going to verify that we have the correct recipient. So this consent form supports sharing for treatment, payment, and operations, and it looks like that's what Leonardo has selected, and OCR has detected that accurately. So we're going to go ahead and move forward. And then we're going to review the consent expiration. And it looks like Leonardo has asked for 1 year from the date of his signature. That's correct. And then the next part of the form is something that's quite untraditional. We have seen some parts of this, but it is listed in CFR Part 2. And because this form is shared within ConsentLink to be a standard for other organizations, if you're not sure if your form is compliant, we include an area where your organization's information, so the disclosure, can enter in who the patient can reach out to if they want to, revoke the consent or cancel sharing. So it looks like our information has pre-populated. We can go ahead and select next and review the signature aspect, and everything looks valid and compliant. So we're going to go ahead and click submit. And we have a validation error. It looks like the phone number had a couple extra spaces. Perfect. So now that consent has been created, and we can go ahead and review that. It's an active status. Angela Test has gone through OCR verification, and the expiration is listed on the top here in a year from today. So that is how the OCR aspect looks. Another part of this is that if for some reason maybe you don't have the time, or you're uploading and scanning a bunch of consents and you're not verifying that information at that moment, there is a backlog where you can go into reviewing OCR consents that need verification. So maybe it didn't catch a name or something, maybe the client entered June instead of 6 for the date. This is where you would go to review and make sure that that is accurate. Okay. And so another aspect that I would like to cover is the administrative aspect of ConsentLink. So say you work in privacy or compliance and you just onboarded a new supervisor and you would like to update their security permissions. And so you could go into admin, users, click add, and enter in your new employee's information, select their role, and enter in their permissions. So ConsentLink is very flexible in terms of allowing the end user to have access and permissions that are needed for an end user. So with that, I'm going to go ahead and move into another scenario. Say I am a health information director, health information management director, and I would like to look at the reports for the last month to see what the user activity is and how we're spending most of our time. So I would go into user activity, reports user activity, and then select the date. And I would be able to populate the report. Might take a minute to load. And it'll display the user information, the email, which consumer was referenced, if there are any external IDs, timestamp, and the activity that was performed, and the device that was utilized. So you can, filter within ConsentLink. The other option is exporting the report. So you would click on Export Report, and your reports would become available within the Download Reports tab. And then you would just download it onto your system. I'm not going to do that here now in the interest of time. The last scenario that I have is creating a consent via direct data entry. So say one of my clients comes in, her name is Katie Johnston, and she's telling me that she would like to share her health information. So I'm going to go ahead and search for Katie. And she would like to create a consent, and we're going to work through this together and select the correct form template. So the first part of the HCA form is informational. So we're going to go ahead and share that with the client. Click next and make sure that we answer all of their questions in case they have any questions about the relationship, the intermediary aspect, or HIPAA. So I asked Katie, what kind of information would you like to share? And she says, well, I would just like to share my medical information. So I select option 1, and then I ask, who would you like to share your information? So since Katie was seen with us, and she would like to share her records from being seen with us, I'm going to go ahead and select option 2. And so we're going to select organization and type in our organization name, which in my case is Test Seed Organization 001. We're going to go ahead and click next. And then the next question asks, who do I want to share my information with? And so Katie's telling me that she's not really sure where she would like to go. She has a couple ideas, but she hasn't decided where she would like to continue her care. So the cool part about the HCA form is that it does support one-to-one sharing as well as for treatment payment and operations. So we're going to go ahead and select the recipient of the information as any treating provider or anyone under TPO. And so that would be option 1. And then I asked Katie, when would you like this consent to expire? And she says, 1 year from today sounds great. And so this is the part of the form that I was mentioning when we were doing OCR. Your organization can pre-fill this during onboarding, or you can leave it blank and fill it out every time that you decide to utilize the form. But in this case, I'm going to skip forward on this just in the interest of time. And so Katie's going to sign. And we're going to select today's date and the relationship. And we're going to submit. And it says, oh, there's already a TPO consent. Would you still like to create this consent? And we would, because we're sharing directly from us to an unknown organization. So then we can go into consents and review the consent form that has been completed. So this can be downloaded as a PDF or printed in case you needed to email it, but any provider with TPO permissions would be able to access this consent form. So if Katie wanted to go to, let's say, UW Medicine, UW Medicine would be able to log in and view Katie's consent form. Okay. And so with that, I think we can go ahead and conclude the demo aspect. So as you've seen today, the system is designed to enhance the way that your organization manages patient consent to improve efficiency, compliance, and overall health data exchange. Before I wrap it up, I'd love to hear your thoughts. Do you see ConsentLink fitting into your workflows? What questions do you have about implementations in a day-to-day use? You can either post in chat or reach out to us and follow up. I know that there are probably questions filtering into the chat, and I might not have the opportunity to review and respond, but we will definitely follow up with that. So thank you for your time, and I'm going to go ahead and pass it over to our Menti folks for the survey. And I'll stop sharing.